Our guest today is Dr. Sia Sobhani, an internist and executive healthcare physician whose practice concentrates on preventative and geriatric care. Did I get that right, Dr. Sobhani?
Yes, yes. Thank you for having me.
You're welcome.
Yeah, thank you.
So, Dr. Sobhani, full disclosure here, I've been a patient of yours for, gosh, I don't know, 7 years, 8 years, something like that.
At least 7, 8 years, yes.
And we're going to give you a chance to talk about concierge, your concierge practice in a moment. But I will say that you've been a focal point of my health for the past, and this concierge practice that you have is pretty awesome. I don't know if you remember back in 2013 when I was in California having a heart attack. I called you on a Sunday morning. Yes. At 10 o'clock, and you picked up and said, "Hello, Mr. McDermott." And I was like, well, that was pretty cool. So the level of support that you give to your concierge practice is amazing. So
I appreciate that.
So we'll give you a chance to plug that later. So, as Michelle said, we're really focused on the caregiver, and during this stay-at-home time, under these stay-at-home shelter-at-home orders. What do you think that families need to think about in order to stay healthy?
It's important for us to realize that this is not a short-term event that we're having. It's a long-term event. And when we are planning ahead, we have to plan maybe for months ahead. It's not something that we say, okay, what am I going to do for the next 2 weeks to get through this? It's more of a marathon than a race, let's say. Right? So when we're planning, what am I going to do regarding my own health, my medications, my appointments with my doctors, we have to say, okay, I had to go check my blood work next week. That's not going to happen. So I won't be able to do it in 3 months. Is that okay? Is that not okay? So the most important thing for everyone to know, especially for the caregivers who are dealing with someone with a chronic illness, who essentially at this point, they're all homebound. They can't take their loved one to the physicians or to outside activities that they might have taken, daycare centers and things of that nature. It's very important for the caregivers to think about their health, making sure that their physical health and more importantly, that their mental health is also addressed. What I've been doing and what I've been trying to let the patients know is that right now, because of the situation, doctors are not expecting any of the patients to come to their offices for any kind of follow-ups. It's very important, though, that patients know that they could still get the follow-up via telemedicine. Now, telemedicine could be done on FaceTime, Skype, WhatsApp, things. But telemedicine could also be done with a simple phone call. So I encourage my patients and I encourage the caregivers to just give a call to their physician, tell them about, okay, I've checked my blood pressure is X, Y, and Z. What do you think I should do? Should I increase my medicine, decrease my medication? Even if they don't have medical ailments or complaints, they could still give a call to their physician, because sometimes just talking to your physician is somewhat heartwarming, somewhat encouraging, reassuring, because you've spoken to the healthcare provider. This is someone hopefully that you trust with your health. And most of us, I'm sure, especially in this day and age, we're very, very open to talking to you on the phone. What the insurance companies have actually done, Medicare and almost all private insurance, have all allowed doctors to bill for the visits. So it's not like some people might think, oh, I might be bothering my doctor. No, your doctor actually wants you to call. We are billing insurances is exactly like an office visit. So we do encourage our patients, which would include the caregivers, to contact the doctor to say, okay, what will happen if I don't check let's say if someone has diabetes and you're supposed to get your hemoglobin A1C checked. So what happens if I don't check it now and I check it in 3 months? Is that okay? And your doctor, private physician should be able to advise you on those things. So we really, really encourage you to call us, be in contact with us, be it via telemedicine or just even a phone call. I think even the doctors are able to charge for phone calls. It doesn't have to be a virtual type of communication.
So are there? So I know when I come into your office, right, you get the standard weight, blood pressure, and a couple other things. You obviously can't do that via telemedicine. Should people be investing in a couple pieces of equipment for their home, like a portable blood pressure or obviously thermometers? I think everybody has thermometers,
Right.
but are there certain kind of couple things that people should be investing in just to have, so when they do
Sure.
call you, they can give you some of their vitals?
Yeah, so it all depends case to case and the caregivers or the patient's ability to purchase X, Y, and Z. When they do a virtual visit, let's say when you're able to see the patient, one good thing is you could just see the patient, meaning does he look under distress? Is he comfortable? Is he agitated? The visit could be done with the caregiver's person they're taking care of, meaning so if it's a screen where there could be a couple of people involved in the screen, then the doctor could also see the caregivers, whoever they're taking care of. Yes, you could go out and buy blood pressure cuffs. So easily you could check a blood pressure. The doctor could see it. He could make sure that you're checking your blood pressure correctly. It's actually a plus, in my opinion, because this way I get to see the patient at home. So instead of him telling me, yeah, it's a green pill or a blue pill, we could actually take a look at the pill box and see exactly what he's taking and when he's taking it. As opposed to relying just purely on the memory of the patient to tell us, yes, I take one pill in the morning and I'm not sure if it's my blood pressure medicine or my cholesterol medication. So I think that's a very important plus for us to be able to see the home environment. Even opening up the fridge, we take a look and see, okay, my diabetic patient, when she says, no, I'm very careful, is there ice cream? Is there sodas in the fridge? And then we could discuss that further and help them with that diet. You could go beyond that. There are available ways to check not only for your blood pressure, but you have gadgets out there that you could purchase that checks I could listen to your heart while we're doing a quote unquote virtual exam. So you put this gadget on your heart. I could listen to the rhythm, how fast it's going, how slow it's going. Let's say you have a sore throat. There's a gadget you could put inside your mouth, and I could actually see in your mouth or in your ear. One of the ones out there is called Taito Care, and they do remote virtual physicals with those things. There's a number of these handheld smart devices that they could purchase. It's a matter of going and searching online where they are. There's G Medical Innovations, MD Health Track is another one. These days, patients and doctors could go to the lab portals and see all the labs together if they need to. So there are things out there available to us. I think it's very important for, again, the caregivers to think about themselves, to make sure that they are reassured about their well-being. So if they are reassured when they see the doctor and the doctor talks to them and they go through the medications, they think, okay, my health is okay. I don't have to worry about my health. Now I could concentrate on my father, my sister, my mother that they're taking care of. Also, the mental health is very important. So being able to maybe use, I don't know if I'm sure there are out there community volunteers who are working to help. Again, we're all homebound right now, but it's important to be able to get that 5-minute, 10-minute of release from that. So there might be churches out there, community volunteers who will come. Again, you have to take your precautions. Don't forget, you cannot eliminate the risk of getting the virus. You want to lessen as much as you can the risk of getting the virus. So if someone could come maybe when the patient is resting, is sleeping in the bedroom. Maybe someone could come to the house and just sit there for half an hour in the waiting room while the caregiver goes out for a quick walk just to get some fresh air.
Yeah, those are. Oh, I'm sorry.
So it's important. Again, it's very important, I think, for the caregivers to reach out to their private medical doctors.
Exactly. I think it's fascinating to me because I remember when Sean first told me that he had a concierge physician because he was traveling all the time and he was tired of getting sick and going to like a minute clinic because of all of his work travel. I remember thinking and asking, what's a concierge doctor? I didn't really understand. And so what's fascinating to me now is we're in this situation where families are forced to be indoors, and we're so concerned about the caregivers on a normal day, a normal week when there wasn't coronavirus and there wasn't quarantine. So the whole idea that that families can invest in invest isn't the right word, but can have these conversations with their physicians remotely and virtually is amazing. And you kind of already answered the question. You said it is okay if adult parents can facilitate the visits. Maybe I know our mom would probably much prefer if I joined a virtual call with her and her physician. Number one, she doesn't love technology, and number two, she just likes to know that someone is with her listening to what the doctor is saying.
Right.
And I think the reverse of that is we as adult children that are worried about our parents that are quarantined, we would feel better if we knew what the doctor was actually saying. And so I'm really encouraged that this is an option for really everyone right now. And maybe it was this pandemic that kind of opened the doors and made it available to more and more people because it's a necessity, right?
Yes, absolutely. So I think right now, because of what's going on, suddenly the importance of your healthcare provider and the access to your healthcare provider becomes very relevant and real. Whereas before, you might have not thought it was that important. I'd rather join this fancy gym and pay this monthly fee for that fancy gym rather than being able to contact my healthcare provider when I need the most. And like you said, right now it looks like everyone is able to contact their provider via telemedicine agreements.
Is that new? I mean, have there been a lot of restrictions that have been lifted in the last couple of weeks because of the COVID-19?
Absolutely. Yeah, absolutely. So beforehand, if you and I were having a conversation, be it live, be it just the phone, we could not bill for it. Medicare had something, if you're talking to a patient for 15 minutes, there's some billing, but the reimbursements are minimal. So no doctor was doing that really. But right now, because of what's going on, the insurance companies, and I think it's federally mandated, I guess, that they have to reimburse the physicians just as if it's an office visit. So the office visit has different complexities, level 1, level 2, level 3, level 4, level 5. And we're able to bill the patient's insurance company based on how long we're doing, what we're talking about, and things of that nature. They actually have said, the insurance companies, that they're waiving copays, which I hope means that the insurance companies are paying the patient's copay. But at the same time, different doctors might do different things. Some doctors might come back and say, well, the patient owes me a copay. I think most doctors at this point are just happy to be able to communicate with their patients, as opposed to not be able to communicate at all for months to come with any patients. That means they would have to close their office, to be honest with you, because they have their expenses, their rents, the staff. We're trying to keep the staff going. We're trying to keep our offices open because patients still need their care. So it's a good opportunity that's been given to us. It's been given to the patients. Again, for the caretakers to know that they are able to talk to their doctors, seek help, seek advice from their physicians, and the insurance companies will repay the physicians for that, reimburse the physicians for that.
Do you think this is going to continue to stay, or they might roll back some of this after the crisis is over?
I think it will roll back in the sense that I think telemedicine is going to move forward. So telemedicine, remote physical exam, remote office visits, I think is going to, obviously technology is going to keep moving forward, where someone like yourself, Mr. McDermott, you might not find the time to come to the doctor's office, but you might be able to get these devices where your doctor could actually do a physical exam on you. remotely. That is not going to be true for everybody, or I should say maybe for most people, because some of these gadgets that you have to buy for those things might be too expensive.
Well, I'm not going to let you open up my fridge on telemedicine, so that's not going to
So
work.
yes,
well for me.
telemedicine actually is going to be the wave of future. It cannot take the place of a human's touch, right? So when you come to the office and your doctor puts his hand on your shoulder just to reassure you, I think that's part of the healing and health and well-being of the patient. So you need that personal touch when it comes to taking care of patients, in my opinion.
Yeah, I couldn't agree with that more. You know, I love the idea of telemedicine, but I think the personal approach and the you know, a doctor looking me in the eye and say, you know, you're going to be okay, is worth its weight in gold, right? And so that I hope never goes away. I just do like I like the idea that families have some options during this time. I'd like to really understand, if you are thinking about the senior population, all caregivers to someone with Alzheimer's are not seniors, right? Alzheimer's hits younger people too, but
absolutely.
Primarily we're looking at, you know, we get very worried about the seniors because the pressure is just immense, and now they're home for who knows how long. The state of Virginia is saying until June 10th. So what I would like to do is understand, how can adult children and families and organizations like ours, how can we help educate families on more than just sick calls to the physician, right? Not just my blood sugar is high, I call my physician, but you know, what are the normal kind of things that you would be looking at for seniors for just their well care on a quarterly basis, say?
So I think it's perfectly okay that you don't have to call them for acute illnesses at all. You could call them for acute illnesses, but you're following up on chronic illnesses. So let's say if they have high blood pressure, cholesterol issues, and it's time for their visit. So every 6 months, I often see my patients with chronic illnesses 2 times a year. So every 6 months, some doctors every 3 months. So that could be an office visit right there, where they just call in to check in, to see how things are going. How is your diet been? How is your mental health has been? Even if you're completely healthy, and let's say you have people with Alzheimer's disease who all they have is Alzheimer's disease and they don't have any other medical illnesses. No blood pressure issues, no cholesterol issues, nothing else besides the Alzheimer's disease. So even those caregivers could call in to check in with the physician about a follow-up, how they're doing, as far as, you know, their mental health is doing, their physical health is doing, how things are at the house. So it does not have to be a call for an illness. It does not have to be a call for just a follow-up. It could be a call to chit-chat with your physician, to ask about, so what do you think is going to happen to the coronavirus? What should I do? What precautions to take? I also would encourage them to contact their local community to see what other support systems there are out there.
Right. You know, right now, at least in this area in Northern Virginia, there's really very little is available. All of the services that were have been shut down, right? They're all under quarantine. So home health agencies and home health care are still going into homes and still able to help in that way. We spoke to someone yesterday that offers teletherapy, emotional mental health type of therapy that they can do, like you do your telemedicine, which is really nice. But there aren't a lot of services available at all for our seniors. And all of the organizations, especially the senior daycare centers that have, the respite that some of these caregivers are so used to, it's so hard for them. They don't want to be closed, but the risk is just too high, too high for their clients.
Absolutely.
So, I think when this clears out and, when everything opens back up again, those services are going to be available to them and they'll be back at it, and they'll get some more respite that they're not getting right now. But I worry about just the day-to-day things that they should be taking care of themselves that they're going to either ignore because, they don't think it's that important, or they're going to be afraid because they're not feeling well and they don't know what to do about it because
Right.
they're being told not to leave their home.
So I think that's one reason why it's important for them to reach out to their healthcare providers, even if they want to find a new healthcare providers. I think there's Health Grades, Yelp. They have some apps that I saw are new for patients who are seeking physicians who are doing the telemedicine. So these people, if they don't have a healthcare provider, they could go to Health Grades, it's called, or Yelp. And these are providing patients, clients with names and information regarding doctors who do telemedicine. In the community, my sister-in-law is from the Baha'i faith, and I was talking to her, and they have volunteers that help go out and maybe do grocery shopping for the elderly, let's say. And I'm hoping that in all the faiths there may be, that's why I said maybe the churches, maybe the synagogues, these people have a volunteer force maybe, that younger people that are less at risk to go out. There are apps when you say for the health of the patients themselves, the caregivers. It is very important for the caregivers' mental health, physical health to be addressed, and they should be aware of this. My wife does about an hour of yoga every day. So there's an app she uses. Whoever she was going to do her yoga with now is on virtual yoga thing. There's virtual symphonies. So people could go if they like the arts. There's virtual museums they could look at. These things might be helpful because it takes your mind off of what's going on to some degree. One thing I tell my friends, my relatives, my patients is when you watch news, if you're sitting there and watching news, constantly you're getting bombarded with very anxiety-provoking news.
Absolutely.
So I say, you know what? When you want to look at the news, ABC, CBS, NBC News in the morning. It's a half an hour news broadcast. They basically will, and in the evening, they'll give you the synopsis of everything that's going on. They don't tell you about the very scary stories just to get viewers attached. So you just want to get the overall gist of, okay, where are we right now with this virus? You don't want to hear about the 13-year-old child who X, Y, and Z happened to, and that just causes more anxiety for you. Instead of that, they could, again, go on these sites where they could do virtual museum visits, exercises. There's dance exercises, stretching exercises, all on virtual programs. And I think it's just a matter of, like you said, someone has to be a little tech savvy to go search these things and find them.
Well, one of the things that we talk about a lot, have been talking about a lot over the past couple of weeks, is making sure that the people around the caregivers are intentional with them too, and that's why things like Zoom is, it's really cool. Like I have one of my employees that does a church, runs a big part of a church, and they did a virtual dinner the other night, and they had 18 families on this virtual dinner, and we're doing virtual happy hours for work and things like that. But you can point that to your community, right, or to your caregivers. Absolutely. And you can say, hey, let's all get together and FaceTime with grandma, But you got to be intentional about it, because we get so caught up in things, and that you end up just kind of like, oh, I'll do it tomorrow. Next thing you know, it's been a week, right? So.
Right. Our foundation, the Alzheimer's Caregiver Alliance, supports a couple of memory cafes, and we're now hosting a virtual memory cafe. So we just did our second one this week, and I was really encouraged because the caregivers, they were all smiles and happy, and they all had really good attitudes. They're dealing with a lot. They've got a person at home with dementia, or a person with dementia that's in a facility that they can no longer visit. And I was super encouraged by their attitude, and they're like, we're doing this, we're doing well. And they're talking to each other and giving each other advice on how to get their groceries delivered. So, I think we have this opportunity as a community to teach the seniors that might not be as tech savvy as we are, and, teach them and open up a whole new world. So I think that's pretty exciting. And we're also
Yeah, I
going to
think it
launch
is.
a virtual art program too. So we're going to be doing some art programs, which offer another form of respite for caregivers. And we'll see if that is, we'll see if that takes off. I feel like that can be a really great thing for the caregivers they don't have to leave their house, so they don't have to find someone to watch their loved one. They can just do what they can, and we'll see how it goes. But it gives all of us an opportunity to really kind of brainstorm and think outside the box.
Yeah, just like we're doing right now, I'm sure there's apps where 10 caregivers could be on the same conversation. They're seeing each other, they're talking, giving each other support. I think that's helpful. What you're doing is very helpful.
Right.
And necessary,
We're doing
very necessary.
Very necessary, right. We have, next week, we have the yoga instructor that had normally been coming to the Memory Cafe. She's going to do gentle yoga via Zoom. And we'll see how it goes. We'll have to work out a few things, I'm sure, just so that everybody feels comfortable. But I think if we just continue doing that, and we as an organization get out to families and let families know you have options. If you're worried about your loved ones, you're worried about their health, there's things you can be doing right now. You can be proactive. You can contact your doctor. There's telemedicine options that are most likely available across the country. There's mental health therapists virtually available across the country. So it's just a matter of letting them know that, because I've never done anything but just go to the doctor, so I wouldn't really have that advice to my mom or my dad, because that's kind of all I know. So this is even a new world for me, the whole idea of telemedicine.
Yeah.
And super interesting.
I think it's a new world for all of us. All these different aspects of what we have to do to adjust to what's going on right now. Hopefully, it will bring a lot of good. At one point, bring out the best of people, especially those like yourselves who are always out trying to help others. That's very. You guys should be very proud of yourselves.
Well, we appreciate that. Well, Dr. Sobhani, it's been great talking to you.
Thank you so much for having me. I really enjoyed this.
No problem.
Yeah.
And I appreciate all you do, and appreciate you guys on the front line, battling this stuff for us. So
absolutely.
Good. So just to kind of wrap things up, so one of the things that we're always looking for is people to join our community. So you can go to our website, windwardfoundation.org or alzcaregiveralliance.org, and sign up there. Join our community. There's no cost. There's more resources that you can get through that, and we'll be continuing to deliver even more resources in the future. So hopefully you can make it to our website and join our community. And I guess, Michelle, we'll see them next time, right?
Yeah, next time.
All right.
Very good.
Thanks,
thank you again. I really enjoyed
Thank you so
being
much,
on the show.
Dr. Sobhani. We really appreciate it. Thank you.
Sure. Take care. We'll be in touch.
Bye-bye.
Bye-bye.